Did you know that drugs and medication are not the only way to treat diabetes? Well, in this video, we are going to educate you about some other things which you can do when you have diabetes, or if you have a patient who has diabetes and they help you to control your blood sugar. Hello, our dear viewers. You're welcome to this YouTube channel, Health Tips and Tricks. I am your physician, Dr. Andu, to take you through. If you're new, kindly subscribe. And if you've missed our previous videos, check our site and view them so that you learn more about your health. We are going to look at diabetes once again, and today we are looking at what are some of the other things that you can do as a diabetes patient apart from treatment, and these will help you to what? To control your blood sugar, or to reduce your diabetes progression, or to even improve your health as a diabetes patient. So to remind ourselves, we looked at diabetes as mostly a disease affecting the pancreas, insulin production, and your body. And at these 3 points in your body, we realize that if something goes wrong, if anything goes wrong, then you can easily get diabetes. So even when we are, as physicians, when we are prescribing for you drugs and giving you insulin to treat diabetes, these are the 3 points we look at. We look at your pancreas, we look at insulin production, and we look at your body, your other body organs, and also your body as a whole. How is your body? Are you obese? Are you healthy? We look at all that in order to get you the best medication. So on top of that, medication and insulin may not be the only things that can improve the working of these 3 parts of your body. We also have other ways we can protect our pancreas without using medication. And what are some of these ways? One, we shall begin from the pancreas, of course. Now, looking at the pancreas, how can we protect it? Remember, we said whenever you take a meal which has sugar or glucose in it, this will cause elevation of your blood sugar, and the pancreas will have to come in to work and lower your sugar. So we said if you take a lot of glucose all the time, then you are overworking your pancreas. So what can we do to prevent that? We can eat foods which are low in sugar. And by saying foods which are low in sugar, it can be a bit confusing because we may not know. How would you know that this food is low in sugar and this one is not low in sugar? It is difficult, but that's one of the ways in which we can know, in which we can help our pancreas not to strain, not to work hard. And in that sense, we shall be protecting it and give a chance to some of the cells which have already been damaged because of diabetes to recover and become functional once again. There are cells which produce insulin, and these are the cells we protect by not eating foods which are very high in sugar. So for example, fruits and vegetables. We have vegetable foods, foods rich in fiber, and we all know vegetables are rich in fiber, but we have other foods which are rich in fiber. And such foods will help to protect your pancreas by not causing excessive or high glucose excursions. That is one. Two, we can protect our pancreas by treating every illness promptly. For example, you get a viral infection, go to the doctor, treat it. You get a bacterial infection, go to the doctor and have it treated. And this will prevent damage of the pancreas by some of these infections and organisms which can enter our body and cause different damage in different body parts. Then we can also avoid taking unnecessary medications. For example, you get a headache because maybe you've not been taking enough water and you swallow a tablet for the headache. You swallow a painkiller. And some of these have not even been prescribed by our physician. Self-medication is one of the ways in which we can damage our body organs, and that includes the pancreas. And once the pancreas gets damaged, then diabetes will progress, and we shall also acquire it in case we have not been having it. So one of the ways of protecting your pancreas when you're diabetic is by not doing what we call self-medication. Only take drugs which have been prescribed by the doctor, and not every ailment to your body needs a medication to be treated. And this also includes herbal medicine. Different herbal concoctions we take have different chemicals that may be harmful to our body in one way or another, and these also can damage our pancreas and lead to worsening of our blood sugar control and our diabetes. Then of course we can also protect ourselves from different things like lifestyles which are not healthy. For example, smoking, alcohol. By avoiding these, we are also protecting our pancreas and reducing our progression of diabetes. Then, what other foods can we eat which are good? There are certain foods which are rich in antioxidants. Now, what are antioxidants? In our previous videos, we saw that antioxidants are certain chemicals which are from plants, and these help to clean our body, to clear toxins from our body. And if we take such foods which are rich in antioxidants, for example, foods like aloe vera, they may not be foods necessarily, but things like aloe vera, beetroot, some of these other plant products which are rich in antioxidants, they will help our body to cleanse it. And once our body is cleansed, this protects our organs and gives them longevity. And this also includes the pancreas. So that is another way in which we can protect ourselves by protecting our pancreas and thus reducing our diabetes progression and also helping our sugar control. Then, of course, moving on from the pancreas, we have the body. That's another area where we can do several things without necessarily needing medication to address some of them. For example, exercise. Exercise is a very good thing. Why? Because it will increase your glucose utilization. So if you have glucose in your body and you're not using it, then it will accumulate. But if you have this glucose and you utilize it by doing exercise, this will also help to lower your blood sugar. Then looking at our bodies in general, we talked about fat in our body, and we have the good fat and the bad fat. And some of this bad fat accumulates and replaces our muscles. And that's when we start becoming obese. So if we do exercise and we increase our muscle mass, the muscle mass will replace some of this bad fat, and this will also improve our blood glucose control because the muscles will utilize the glucose, and that will help us as diabetic patients to utilize this glucose and thus lower your blood sugars. Then weight loss, of course, is another very important thing. If you're a diabetic patient and you have you are overweight or you are obese, then you also have to lose some of this weight. And by losing this weight, it will improve your sugar control. Why? Because it will increase glucose utilization in your tissues by improving what we call sensitivity to insulin. It will enable your insulin to work very well in your body, and this will also help to lower your blood sugar. Then, of course, we have other activities we can engage in. For example, keeping healthy in mind, healthy in spirit, and being relaxed and calm. This will also help us because it helps our brain. And like we said, our brain is a central organ in the body which can control the working of all the other organs. And if your brain is calm and peaceful and good state of mind, this will also help to address some of the other issues which you can be having, for example, when you are a diabetic patient. I hope this was helpful. We have looked at some of the ways in which you can control your blood sugar when you're a diabetes patient without necessarily using medication. And these are like add-ons to the medication. We have seen what foods you can eat to reduce glucose excursions. We have looked at foods rich in antioxidants that help to cleanse your body. We have seen exercise, we have seen weight loss, and we have seen avoiding things like alcohol and smoking, which are unhealthy lifestyles. Thank you very much for your attention. I remain your physician, Dr. Andrew, and keep tuned in.